Hi everyone, my name is Jenna Lynn Kelly, and I'm a fourth-year pharmacy student at the University of Connecticut School of Pharmacy and Pharmaceutical Sciences. Today I will be walking you through a blog post I wrote along with Dr. Jennifer Gerardo, a clinical professor. This blog post is titled Ceftazidime Avibactam, Managing Pediatric Drug-Resistant Gram-Negative Infections, and is a review of the role of ceftazidime avibactam in children with drug-resistant gram-negative infections following the publication of a new observational study. You can find this blog post on the UConn School of Pharmacy and Pharmaceutical Sciences website under the Pediatric Infectious Diseases and Immunization Update blog series. Morissette and colleagues recently published a retrospective observational cohort study assessing the use of ceftazidime avibactam in pediatric drug-resistant gram-negative infections. This study adds to current literature by providing real-world outcomes data on the use of this antibiotic in children, for which there has historically been limited efficacy data. Out of 100 pediatric patients, 73% experienced clinical success upon treatment with ceftazidime avibactam without microbiologic or clinical recurrence within 30 days of discontinuation or development of resistance within 90 days of initiation. 97% of these patients also clinically improved without needing treatment modification due to suspected therapeutic failure. The optimistic clinical outcomes from this newly published study demonstrated on the previous slide alludes to ceftazidime avibactam's trusted role in treating drug-resistant gram-negative infections. Its reliability is emphasized throughout current literature, including 2024 guidance provided by the Infectious Diseases Society of America, or IDSA. Even though pediatric efficacy data has historically been limited, there are several primary sources that present promising results. The latest real-world outcomes data augments the already well-established place in therapy of ceftazidime avibactam and serves as a useful supplement to existing pediatric literature. The publication of these real-world outcomes is timely, given the concerning rise of gram-negative antimicrobial resistance. Because of this alarming uptrend, the U.S. Centers for Disease Control and Prevention, or CDC, issued warnings of national threats, including a serious threat for multi-drug-resistant Pseudomonas aeruginosa and an urgent threat for carbapenem-resistant Enterobacterales. These threats become even more problematic in the presence of inappropriate antibiotic prescribing. Fortunately, ceftazidime avibactam remains a reliable antimicrobial option for pediatric patients amid this rise of antibiotic resistance. The value of ceftazidime avibactam in practice depends on the commitment to uphold ideal antimicrobial stewardship principles, such as appropriate evidence-based dosing and administration. FDA-approved dosing of 50 milligrams per kilogram or 2 grams of ceftazidime every 8 hours is consistent with current pediatric guidance, but it is important to ensure a prolonged infusion time of 3 hours to maximize the pharmacodynamics of the medication as suggested by Lockowitz and colleagues. Appropriate antibiotic use will not only lead to optimal therapeutic outcomes, but also preserve the novel activity of the drug, especially given the current threats of antimicrobial resistance. Lastly, pharmacists should evaluate the results of this observational study as a supplement to other existing literature when considering ceftazidime avibactam for drug-resistant gram-negative infections in the pediatric population. Thank you for watching this summary of ceftazidime avibactam, Managing Pediatric Drug-Resistant Gram-Negative Infections within the Pediatric ID and Immunization Updates, a partnership between the UConn School of Pharmacy and Pharmaceutical Sciences and the Pediatric Pharmacy Association. To learn more, please go to the full blog post using the link in the description of this playlist. If you found this video interesting, please be sure to like, follow, and subscribe to the University of Connecticut School of Pharmacy and Pharmaceutical Sciences channel and our playlist. Have a great rest of your day. This information is for educational purposes only.